So these are the objectives today. We're going to talk about major structure and functions of the brain. Some of you will know much of this, but we'll just go over it. We will talk about two specific domains of cognitive function which are particularly important in aging and also in developmental disorders. Then we'll talk about two types of what we're calling unsuccessful aging and two types of successful aging. We will all fall into one of those four categories. Okay? Then we will move into the afternoon talking about nutrition and what really is the role in nutrition in this whole notion about continuing to age gracefully, age with our cognition intact. As you know, the lifespan of the United States is getting longer. Therefore, there are more disease-related events that are occurring. By the time one is 85, 40% of the population of the United States will have Alzheimer's disease. Okay? This is a huge number. So, as we get older, we are at risk for more diseases. Then we'll finish up the day, hopefully around 3:30 to 4, about what is on the horizon, what breakthroughs have occurred or are about to occur that will actually change the way in which we age. Will it be possible for us to age with our cognition completely intact until the day we essentially pass away? Okay? These are brand new cutting-edge findings. Unfortunately, this is the shortest part of the program because there is not that much out there. But there are some things that I think you will find interesting. What are the risk factors for MCI? Well, you know them all, right? Elevated blood pressure, your serum cholesterol is too high, diabetes, which is a big one now, osteoporosis, etc., chronic obstructive pulmonary disease. Diabetes, I've actually heard, and I hope this doesn't get into the literature, my God, that Alzheimer's disease, because of the risk factors of diabetes, is in some parlance being called type 3 diabetes. Okay? That's how serious people are taking type 2 diabetes. It puts you at risk for MCI, and there's some relationship to diabetes and the development of Alzheimer's disease. My daughter is a pediatric endocrinologist working at Children's Hospital in Boston. When she began to practice, her mentors told her that some of the kids you're going to see may actually come through the door with type 2 diabetes. It'll be rare, but you'll see occasional, right? Today, that represents about 15% of her practice. This is a pandemic, folks. We are seeing kids, and if you have type 2 diabetes at that age, your trajectory does not look very good. And we are in big trouble in trying to deal with this. We can talk a little bit about that later. Okay. Dementia, and by the way, I should mention one perfect storm for MCI, and that is metabolic syndrome. So if you are obese, you have high blood pressure and elevated serum cholesterol, you are at significant risk for developing MCI. You should check your CRP levels. What is that? How many of you actually know your CRP level? Like 5 people, 3 people? C-reactive protein is a measure of inflammation, which may be some index or proxy for metabolic syndrome. Your doctor usually won't offer it to you, but you can ask. Okay, so now what have we done? We've taken dementia and Alzheimer's disease and now called it major neurocognitive disorder. And to make matters worse, these are the requirements for Alzheimer's disease, but Alzheimer's disease by itself is not listed as a DSM-5 major category. I don't know how we did that, but we did. So, what has happened is we now have a classification called MCI of the Alzheimer's type, or MCI due to Alzheimer's disease, as a category recommended by the Alzheimer's Association and the National Institutes of Health, which suggests that there is an MCI that you can be diagnosed with that is attributed to Alzheimer's disease. And that just may not be true, as I just told you, right? So we have really confounded the definitions. Okay, there are 90 different causes of dementia. Alzheimer's disease by far is the most common. It accounts for 50% of all dementia. The next two dementias are vascular dementia and Lewy body dementia. Each of those probably account for about 15 to 20% of all dementias. I'll indicate what each one is in a moment. So these three, Alzheimer's disease, vascular dementia, and Lewy body dementia, probably account for about 95% of all dementias. The other 87 causes are distributed across that 5%. Okay? So these are by far the most common. The most common of the rare dementias is frontotemporal dementia, of which you probably have heard one of them, and that is Pick's disease, right? So this is a cluster of dementias that are characterized by affecting the frontal and temporal lobes. Alzheimer's disease, you've heard the numbers, you're all familiar with this. It is becoming an increasing problem. At the turn of the 19th century, the lifespan in the United States was, anyone know? About 49. Now, if you're a Japanese woman, your lifespan, average lifespan is probably 89. Okay? We are in dire straits, folks, because we are in no way prepared to deal with an aging population, because aging is the primary risk factor for Alzheimer's disease. This is the tip of the tip of the tip of the iceberg. We have our heads in the sand regarding how are we going to deal with all these people and their caregivers who are suffering even more than the patients. When China made their decision some 30, 40 years ago to limit family to one child, right? They thought this was a great idea, right? You're seeing the consequences now of China eliminating the Confucian extended family. Why? Because all these kids have now grown up in a single-family household, and now the extended family is not there to take care of the eldest who now has Alzheimer's disease. So China is scrambling to build facilities to take care of all these individuals. Right? We are not that far behind because we don't have the facilities to take care of all these patients. And here's what the Alzheimer's Association has done. Even though I work closely with them, this is what happened as part of the deliberations. We now have a category called preclinical Alzheimer's disease. What does that mean? That comes from the possibility that Alzheimer's disease is actually starting when we're in our 20s and 30s. And how do you diagnose that is the question. Well, the diagnosis right now is done through a PET scan. There's something called the Pittsburgh compound, which will illuminate the plaques in the brain. But that in itself is not a diagnosis. So now the drug companies don't know what to do. We don't know how to approach this, because if the disease starts when you're 25, how are we ever going to deal with that one? So here is the entorhinal cortex. This is a cross-section of the brain. We'll break for lunch in a few minutes. I think we're almost there, yes. So here's a cross-section of the brain. There's the hippocampus. There's that little strip of entorhinal cortex I told you about. That's where the disease starts. It then moves its way into the hippocampus. Alzheimer's is a very organized pathology. It kills cells in the subfields of the hippocampus and then spreads out into the rest of the cerebral cortex. Okay? Here is the brain of a patient with Alzheimer's disease on your right. And here's a normal control. This is a 65-year individual on your left. You can see the hippocampi have shrunken dramatically. They have been destroyed, right? And that's typical scan of a patient with Alzheimer's disease. Here are those very select neurons in the basal forebrain I told you about. Remember? The ACH, acetylcholine neurons, there they are. Very few of them. This is the base of the brain. This is a cross-section. There's the midline. And that's all they are. And if those go, you lose your acetylcholine, and that adds to problems. There are the plaques and tangles of the classic hallmarks of Alzheimer's disease. These are tangles in the cortex. They look like little candle flames. They are the tombstones of neurons. Those neurons are dead. That's what's left over. These are the plaques, which is now the target of therapy in Alzheimer's disease. If we believe, in fact, that the plaques are causing the disease, it looks like little drops of solder on the top of the brain. They're little pieces of neurons that are clumped together. Okay, let me just get through this and we'll break for lunch. If you look at the neuropsychological profile for Alzheimer's disease, right, these 5 domains, remember? So you now know which domain is likely to be affected first. It's going to be executive function, right? And indeed, executive function does change early on, but 2 other things happen. One is that memory undergoes what we call rapid forgetting. I'll explain that in a moment, because that is what distinguishes Alzheimer's disease from every other dementia state.